Good afternoon. Thank you for joining us today for the latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 962 new cases of COVID-19, which brings our statewide total to 104,358 Pennsylvanians who have tested positive for COVID-19 in all 67 counties. Tragically, 7,079 deaths have now been attributed to COVID-19 in Pennsylvania. Today, I'll be giving you a few updates on our data, as well as providing updates on testing locations for COVID-19 in Pennsylvania. As you are all aware, Pennsylvania continues to see an increase in our COVID-19 new case numbers. I do want to note that there was a delay in the data from Philadelphia being reported to the state yesterday, and so that was not captured in yesterday's statewide numbers. Because of this, today's reported case numbers for Philadelphia reflect both yesterday, July 22nd, and today, July 23rd. Every region in the state has counties that have seen a 7-day average rate of case increase for COVID-19. That is why the statewide mitigation efforts taken last week are so important. The choices we make today will impact the spread of the virus in the days and weeks to come, and also impact the opening of schools in just about 6-7 weeks. So please, do your part. Think of your loved ones. It would be devastating to be involved in spreading a disease like COVID-19 to someone you love when there are steps that you can take to prevent the spread, like wearing a mask and washing your hands. If you have symptoms that are consistent with COVID-19, it's very important to stay home, isolate, avoid contact with others, and get tested for COVID-19. To get tested, please contact your healthcare provider or schedule an appointment at one of our 442 publicly accessible testing sites in Pennsylvania. At the Department of Health, we continue to review and make changes to our strategies during the pandemic. As you've seen from changes in executive orders and guidance, our strategies have been and will continue to be evidence-based and continue to evolve. This holds true for our testing sites as well. When we established our testing strategy, we wanted our testing to be accessible, available, and adaptable, and we continue to meet that challenge. We are constantly analyzing our data to ensure that anyone who believes that they have symptoms of COVID-19 can get tested today in Pennsylvania. Because this is a moving target, I strongly encourage individuals to check the Department of Health's website to the most up-to-date testing locations at www.pa.gov. Actually, www.doh.pa.gov. We will continue to monitor and shift resources to best serve the needs of Pennsylvanians. So here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds. Or, as we all know, the time it takes to sing Happy Birthday twice. Use hand sanitizer if soap and water are not available. Cover coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces that can spread the virus. Clean surfaces frequently. And if you're going out and you're going to have contact with others, please wear a mask. These are very powerful devices in terms of preventing the spread of COVID-19. If you have questions about your health, as always, please contact your healthcare provider. If you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741, or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. If you or someone you care about needs help with a substance use disorder, please call the Department of Drug and Alcohol Program's Get Help Now hotline at 1-800-662-HELP. Again, that number is 1-800-662-HELP. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay alert, and stay safe. Thank you, and I'm pleased to answer questions.
We will be taking questions that are on topic, please. Brian, go ahead.
In terms of on topic, what do you?
If
Just
there
ask
is a question that is not on topic, we will take one. We will handle it as they come up.
Okay.
That's
so
fine.
In regards to last week's restrictions, as you just mentioned, the governor told me he would get me the data and then backpedaled this week, saying that he will not release it. Don't business owners and employees deserve to see the proof that their establishments caused a spike in cases instead of hearing the administration just basically say, take our word for it?
Well, we're not going to be able to produce granular data that X restaurant in X county was implicated. We took this statewide mitigation effort for a number of reasons. We were clearly seeing an increase in terms of the number of new cases in Pennsylvania. The resurgence was primarily in the Southwest, in Allegheny County and other counties in the Southwest. But as I mentioned, actually, every region in Pennsylvania has counties that have had increases, and the majority of counties in Pennsylvania have unfortunately seen increases in terms of the numbers of new cases. We had excellent data and modeling that was presented by Dr. David Rubin last week about how that is spreading really throughout the country, that there are obviously significant outbreaks in Florida, in Arizona, in Texas, California now, and other states, but we are seeing that come up the eastern seaboard. There are increases in Georgia, the Carolinas, Virginia, and Maryland. And so we're not immune to the spread of this virus, COVID-19. And so to mitigate, to prevent the numbers from getting worse, we took this statewide but very targeted action. The factors that contributed to our decision to concentrate on restaurants, bars, nightclubs, and particularly indoor gatherings are that in Pennsylvania, we saw this very clearly in Allegheny County, but really throughout Pennsylvania, in every region, the increases are trending towards younger populations. So individuals that are 19 to 24, individuals in their 20s, 30s, 40s, that are particularly congregating in groups and particularly in restaurants, bars, nightclubs, etc. There is granular data about that, although we're not going to release specific granular data like that. And it's also the trend that has been seen throughout the country. And that has been noted in many other states and noted by Dr. Birx and the White House Task Force and the federal government. We have evidence from our case investigations data. There's excellent evidence from Allegheny County's case investigation data, but also we get reports from the federal government which has highlighted the younger population, the trend towards a younger population, as well as specifically implicating those types of facilities that we discussed, and specifically recommending that where we're seeing increases, and we're seeing increases throughout the state, to target restaurants, bars, and other areas where younger people are congregating. So based upon all of that data, both in Pennsylvania and nationally, and recommendations from the federal government, that's why we took that statewide but very targeted and surgical measure in terms of mitigation to decrease restaurants to 25%, to close bars that are not serving food, to close nightclubs, and decrease indoor gatherings to 25 people.
Lizzie, go ahead.
Thanks. So when you say specific granular data, I mean, are you talking about, is this data that you're gathering from your contact tracing? And like, I mean, I guess what is how specific are we talking? And how granular?
Well, so we have a lot of data from our contact tracing, and sometimes that can specifically say that this person was at this bar at this location, et cetera. Sometimes it doesn't. Sometimes it's more that yes, that person was out and about, but they really can't really tell us where they've been or how many different places they've been. Of course, people don't always go to one place, so I don't have tables that can tell you that this bar has had this many patients. But we have data from our contact tracing. Allegheny County has a lot of data from their contact tracing about restaurants, bars, nightclubs, et cetera, which is why we took that action. Again, that's also the same data that's being talked about nationally and the same specific recommendations that the federal government is seeing in their specific guidance to the states.
What you're describing, is it kind of aggregate data about what sectors of or what types of establishments are? Okay. But is there, so why not release that? Again, I know that Allegheny County made some of that public. So if there's state level data, why not release that?
I think that my impression was that the request was for very, very granular data. We'll be glad to look at it and we'll consider it.
This is similar to Allegheny County.
Okay. I'll be pleased to look at it.
Dennis?
Yes, this is from our station in Erie. They would like to know how schools can open if all indoor events are limited to 25 people, with cafeterias, school buses, busy hallways when classes change.
Well, as we get towards school, we'll see what the guidance is at that time. Of course, that's about 6 weeks away, and the guidance changes. But we'll make an exception in terms of schools to be allowed to allow schools to have in-person, in-person schooling for children and for their teachers, et cetera. And that'd have to be an exception to that recommendation.
Numbers rising though every day. Are you getting more of the mindset that maybe schools aren't going to be able to open in person? Is that?
I mean, our goal right now is that schools will open in person, and many school districts have talked about a matrix in terms of some classes being online and some classes being in person. I'm sure that we'll have to be looking at this, county by county and not just across the whole state. So we're going to stay positive and optimistic is that there'll be in-person school when school opens in August, and we'll be working towards that. That's why the mitigation efforts that we talked about are so important, is that it's critical to drive down the case counts now in terms of the rise of new cases in order to prepare for schools to reopening. If we don't do that now, that would put that in jeopardy.
David, go ahead.
A little while ago, you urged people who might be feeling symptoms to get tested. But what about a person, say, they wound up in a situation maybe against their will when they were in more of a crowd than they wanted to be in, or perhaps they were around some people who weren't wearing masks, and now they need to, say, visit some loved ones who are highly vulnerable, and they would like to get a test. They feel fine, but they would like to get a test to make sure it's safe to visit those loved ones. What's the status of such a person getting a test right now in Pennsylvania?
They can get that test. So we're not requiring that people have active symptoms. We're prioritizing people with active symptoms. The concern about that person getting a test is that depending upon when they were exposed and when they're going to visit their loved ones, a negative test doesn't prove that they're negative, right? In that there's a certain incubation period from the time that you're exposed to the time that you would start to evidence virus and have a test positive. And so if they got a negative test on day 4, but they actually start to develop symptoms and virus production, et cetera, on day 7, that negative test on day 4 will not be conclusive. And so really when we're testing people who are asymptomatic, it's best used when we're looking at it from a population point of view. So for example, in terms of our testing for nursing homes, is that we are testing every patient and every staff member, and that's particularly to prevent the introduction and spread in nursing homes. And so from that type of broad population point of view, testing asymptomatic individuals is really important. I have no objection to testing that person, but I worry that if it's negative, they're going to be complacent that they don't have the virus and they're not going to get the virus. Depending upon the timing, that's not true.
But I'm wondering though, say there is a person who is convinced, it's in everybody's best interest. What I'm trying to find out is, given the availability of testing right now, are they likely to encounter they're going to be told that, sorry, like the test's not available to you because you don't meet the qualifications.
I think that we don't want people who are asymptomatic to go to the emergency department, right? The emergency department are for people who are very, very sick. But if that person called, say CVS, Rite Aid, or Walmart, they can get a test. The issue with the testing that's going to go through the large commercial laboratories is that there's a wait, and that's a national issue. So if tests that go to, for instance, Quest or LabCorp, there's a 5, 7, sometimes even longer day wait to get the results. That's an issue nationally because of the number of tests being done, particularly in the southern type of states in the western states that we were discussing. We have called LabCorp, we have called Quest, and we've spoken with the federal government about our concerns about that lag time, but it's a national issue. It's not something that I can impact. So that would be a challenge because they might not get their test results back for 5 or 7 days.
Just let me ask one more thing, though.
Sure.
Again, based on your up-to-the-minute knowledge, like say places like UPMC and WellSpan, they have various drive-up testing locations. It's not the emergency room, but what about them? Again, based on your your latest knowledge of the supply,
Right.
and that, how likely is it that they're going to be able to get the test, or they're going to be told you can't?
I think that if you're going to one of the hospital testing sites, they're going to prioritize people with symptoms. But CVS and Walmart and Rite Aid, et cetera, are not going to do that. So I think that would be the best place to get that test. However, especially since they're sending it to LabCorp and Quest, there's a wait. Again, a really troubling national issue, which will require a national solution.
Barbara.
Susan.
Sorry, Susan.
That's okay.
I heard that Barbara was coming. My apologies.
No problem. Some bars and restaurants seem to be trying to skirt the requirement to serve food with alcohol by serving humorous, tiny meals, obviously in violation of the LCB regulations. Any reaction to that?
Well, we want people to do the right thing, right? So what we're trying to do is to prevent the spread of a dangerous virus and prevent the increasing case counts in our state, in our Commonwealth, and to prevent people from getting very, very sick, and to hopefully, have schools start in the fall. And so by trying to skirt the rules, you're not protecting the public health, you're not protecting your family and your loved ones, and you're not helping us get school open in the fall. And so, I know that the Pennsylvania State Police and other regulatory authorities are, checking bars and things like that. There's probably a way that you can skirt the rules, but I know that the governor is confident that in the end, Pennsylvanians want to and will do the right thing.
Chelsea, go ahead.
As more and more states, just within the last day, there's been a couple states that have come out and said that they're going to start enforcing their mask mandates. Is that something that has been a conversation between you and the governor at this point?
Well, we've talked about enforcement, but again, there's a lot of people in Pennsylvania, lots of different situations. It's going to be impossible to enforce it completely. So again, this is something where the governor strongly feels, and I agree, that we need people to do the right thing. And the right thing is that if you are out in public, in any setting, whether you, particularly indoors, but also outdoors, is that you wear a mask. And that's going to protect your loved ones, that's going to protect your family and your community, and allow us the best chance to get kids to school.
Do you think that Pennsylvanians are following that mandate enough that you don't need to enforce it at this point?
We want everyone to do that. So I think that the enforcement is going to be challenging, and obviously anywhere it's going to be somewhat limited. So we want to work with people's hearts and minds to do the right thing for the public health of their community and for our Commonwealth.
Todd, go ahead.
Thank you, Secretary.
Sure.
Yesterday, you made a statement about the Toronto Blue Jays not being allowed to play in Pittsburgh, and the quote, part of the quote was to add travelers to this region for any reason, right, could be an issue. Are you planning on taking additional mitigation steps to limit travel, not just from out of the country, but also from other states?
Well, we have a recommendation of states that we recommend that if people are coming from that state for any reason, whether they're just coming from that state to visit Pennsylvania, or there are residents that have gone to that state and they're coming back, is that they quarantine for 14 days. We put out that list every Friday according to new data. We don't plan to order it because it's virtually impossible to enforce. But we took the action in terms of Toronto Blue Jays but it's just more people coming to particularly Pittsburgh and Allegheny County, where we've had increases, and we did not want to take that risk.
Of course, there's multiple college teams that call Pittsburgh home, of course, and then also Penn State, and schools across the state are looking at going back to playing.
Right.
With that threshold in place, with all these case increases, how do you see any sports team, college, pro, taking the field this fall?
Well, so I mean, we've already worked with the Pittsburgh Pirates and the Philadelphia Phillies in terms of their starting their season, and we will be looking at all of our case counts and be looking at the situation when college sports are looking to play as well. So we're not there, so there's no way for me to comment on it. But adding the Blue Jays was just one more factor in a city, in an area that is already challenged, although they were doing a great job. And so my recommendation to the governor, and the governor's final decision, was not to have the Blue Jays play.
The Cleveland Indians just came and played the home-and-home exhibition with Pittsburgh. The Cleveland Clinic apparently yesterday put out to their employees that they want every employee within the Cleveland Clinic system to wear surgical masks while they're on the job, if you will. Are they seeing something different in their data and their mask policy than you all are seeing in Pennsylvania for medical workers and healthcare workers, that they are being required to wear a surgical mask, which may be above the N95?
A surgical mask is not above the N95. The N95 is actually much more protective against COVID-19 than a surgical mask. The surgical masks are the masks that some people even in this room are wearing, and everyone is recommended to wear a mask, including all healthcare personnel. Ohio has not, they might have changed that, but until recently they have not had the universal masking order that we had in Pennsylvania. And so I think the Cleveland Clinic is just emphasizing that in their facility that people should wear surgical masks. They might be recommending surgical masks instead of cloth masks because they're a hospital. So I think they might be catching up to us.
Susan, go ahead.
Secretary, the Center for Public Integrity is reporting that Dr. Birx had a phone call in which she identified 11 cities, including Pittsburgh, as needing to take aggressive steps for mitigation. Are you aware of that? And
yes.
What do aggressive steps mean?
Sure. So we're aware of that phone call. I mean, we always have someone from the administration on those calls, on those national calls. And we know that Pittsburgh and Allegheny County has had increases. So the type of mitigation steps are exactly the type of mitigation steps that Dr. Bogan put into place several weeks ago in terms of restaurants and bars and indoor gatherings. And that's exactly the type of mitigation steps because of statewide increases that we made statewide. And there are some indications, I don't want to jump it, that Allegheny County has decreased its counts from the peak that they had a week or so ago of well over 200 per cases, 200 per cases per new cases per day. And so we're going to be watching the Southwest really closely as we watch the whole state really closely. But that's exactly the type of steps that they have been recommending to us in the documents that we receive, and exactly the type of steps that Dr. Bogan implemented.
Dennis, go ahead.
I have a data question for you.
Sure.
Yesterday there was a rally on the steps of the Capitol, people complaining about the mitigation efforts, and a number of people said the death rate in Pennsylvania is down, it is low, arguing that maybe some of your measures are too strong. But I looked into it, we don't really keep death, you list the number of deaths, but not deaths per 100,000, which is, I think, the metric on deaths that is used, and Pennsylvania is 11th. On the list today that I looked up. What's your thought on where we're ranking in terms of death? And is that not something that you guys even look at? You're more interested in positivity of positive cases? Or tell me metrics in regards to death statistics.
Sure. So we watch all of it very, very closely. So we watch in terms of our total case numbers, in terms of our case numbers per day. We look at the total number of deaths, the deaths per day, where all those are. So we're watching that data daily very, very closely. So yes, it's actually available really easily on CNN COVID-19 website in terms of the death rate per capita. That's just the death rate, the number of deaths per 100,000. And so, yeah, I look at that every single day. It isn't something that we've particularly put out in terms of our metrics, but I know that number every day. And the same in terms of the number of cases we have per 100,000. Yeah.
Lizzie, go ahead.
I just want to go back to testing, especially in regards to schools. So I'm wondering, as we have millions of people, students and school staff going back into congregate settings this fall, hopefully, is there any discussion of or prioritizing teachers maybe as essential workers, or prioritizing testing, or setting aside a stock of testing for schools, for either for students or for staff, if there are outbreaks? And I'm also wondering, with this ambition of opening schools in 6 to 8 weeks' time, what is the state doing now to take as much control of testing as it can? Because last week Governor Wolf mentioned the state is really trying to control its own destiny in regards to testing. And so we talked about rapid testing. Could you just give an update on where the state stands
Sure.
in building up its own infrastructure?
Yeah, absolutely. So we actually, the last day, reported 19,626 tests. Our average tests over the last 30 days is 18,750. That's continually going up. There are 3 or 4 days in the last week or so where we've had well over 20,000 test results per day. And there was one time last week where we were in the very high 20s, like 28,000 test results per day. So we have significantly been increasing our testing capacity, and we're going to continue to increase our testing capacity. There is challenges, as I was mentioning, in terms of the lag time when those tests are being done by national commercial laboratories, which is a national issue which will have to be dealt with by the federal government. Our tests at our laboratory, we can get tests back in 24 to 48 hours. Our tests are prioritized to certain areas, and that has been right now nursing homes. There might be specific school settings where we'll prioritize testing and take it to our lab in Exton. We're not going to be able to do that throughout the state, but if there was a particular concern about a particular school, we can get those test results back quickly. Also, of course, there are tests done, as was mentioned, through many hospitals and health systems. Those results usually come back in 24 to 48 hours. What you're talking about is that, and we would very much like a rapid, accurate point-of-care test that could be done by a medical person, a nurse, maybe even a layperson, where you could take a nasal swab. It doesn't have to be that full nasal pharyngeal swab, which is uncomfortable, maybe a mouth swab, and have a test result in 20 minutes. That really doesn't work. That doesn't exist right now. There are some rapid tests, but there are some limitations to their accuracy. And so we are hopeful that test will become available. The latest evidence we have is that could be October. Love it to be sooner, but we'll see when the tests are available, and we'll do everything we can to access those tests when they become available.
Well, I guess I also just wondering, would it be feasible, for instance, for the state to, multiply by 10 its capacity to process tests in the state lab? How much control really does the state have over, increasing testing capacity so it can handle more specimens?
Well, so we have a number of different platforms that we have, and we can generate about 800 to 1,000 tests per day. Some of the limitations are to the different chemicals and things to be able to run all of those platforms. Supply chain issues, et cetera. So, our lab is not the size of, say, New York's lab, and I don't see that it will be the size of something like New York's lab or CDC's lab or something like that. But we have an outstanding lab. They've been working tirelessly, really, every day, generating test results, and we're really up to 700, 800, sometimes 1,000 test results per day. But we have to use those capacity in a priority setting, and I would fully expect that schools will be part of that as well.
Okay, and then just one more question on the rapid testing.
Sure.
Can you provide any more details about what that program looks like in Pennsylvania? Wolf mentioned last week that there's a partnership with a company. Is that, I guess I'm just wondering, is that something where the state has given money to a company to look into this technology, and what are the sources of the delays? Well,
we're interested in any company, whether particularly in Pennsylvania, because we're in Pennsylvania, but any company that is able to produce that type of test. And so I really don't have any more specific granular detail at this time.
Todd.
Secretary, are you seeing any major changes in the percent positivity outside of the nursing homes, as opposed to that first peak that we went through early in the pandemic in the general population as opposed to the nursing homes? Is there a change in the percent positivity?
Yes, so there has been a change in the percent positivity over the last number of weeks with the case increases that we've been seeing. Right now in Pennsylvania, the percent positivity is 5.7%. In the Southwest, it's 7.3%. Southeast, it's 6.3%. We're talking our healthcare regions. That's how we tend to look at data. South Central is 5.5%. Northwest, 4.0%, Northeast, 3.3%, North Central, 2.1%. We follow that number really, really carefully. And that's something actually that Dr. Birx mentioned in that discussion, was that you need to look for the subtle indicators that you are going to potentially have significant increase in terms of your number of cases. If you wait till you're at if you wait and start to notice it when you're at several thousand new cases a day, it starts to go up exponentially. And we talked about exponential growth previously, where, it's 1,000 new cases, then it's 2,000, then it's 4,000, and now you can see that's 8,000, and look at Florida. And so we're not going to be Florida. I can guarantee you, we are not going to, we'll do everything we possibly can to not have the type of case increases that they're having in Florida. So as we look at the subtle signs, like the percent positivity, that's why we acted last week. That's why we took the steps that they recommended and that they discussed even yesterday in the call. You take targeted mitigation efforts when you're seeing those signs. You don't wait till it's an emergency.
All right, that is all the time we have. We appreciate everybody coming.
Thank you very much.